Hello, I'm Jeremy Faust, the editor-in-chief of MedPage Today. Thanks for joining us. Today, we're going to talk about pediatric vaccines. Last Friday, the FDA decided to not proceed with looking at Pfizer's data for the COVID vaccine for kids under age 5. And that was a bit of a reversal from what they had said they would do. Back in December, we got a sense of the data. We were told that for the 6-month to 24-month-old children in the trial, that antibody levels had been successful. They've been high enough to imply that the 2-dose series worked. But because the older group, the group of 2 to under 5, had not reached that level, they had not managed to get even to non-inferiority, that they didn't want to proceed for any of the groups. And they were going to add a third dose for both groups and see how that went. And then maybe come back and say, okay, for children under 5, a 3-dose series is the standard. At that time, many of us wondered why Pfizer and the FDA did not move forward with an authorization for the youngest group. And I think maybe they should have. Any kid you can vaccinate with a safe and effective vaccine today should be done. But I think that maybe Pfizer and the FDA thought that it might get confusing if 6 months to 24 months would be getting 2 doses, 5 and up would be getting 2 doses, and this little carve out, this 2 to under 5 ages, would be eventually getting 3, assuming that worked. So I think Pfizer and the FDA went for uniformity and saying, let's do 3 for everyone if that's going to work. And at the same time, they're checking to see if a third dose will help older kids 5 and up as well. So at the end of the day, there will be this very simple message that kids would need 3 doses across the board. And you could argue about whether that third dose is really necessary for 5 and up. I think there's really good arguments in favor and really good arguments against that. But that was the theory. Now the question is, what changed? And it's possible that back in December, it would have been wise to move forward with the 2-dose series for 6 months to 24 months, but that in the interim time, Omicron changed things. We know that Omicron is very good at evading protection in terms of antibody response. So it might be that Omicron actually rendered the findings that we thought were good in December less reliable, less robust, and maybe even inadequate. As a parent and as a physician, I think the FDA made the right call. I think it was a mistake to try to move forward with vaccinating kids under 5 with 2 doses of a vaccine that was safe, but not really yet shown to offer that protection that parents are looking for. No matter what we did, if we said to parents, here's the first 2 doses and we'll give you the third one as soon as we know the data, parents would have heard that their kids are vaccinated and they can stop worrying, take off a mask, or resume all normal behavior without any kind of mitigation. I just know that because even with adults, we've seen that. We saw that adults got vaccinated, and the first thing they did after getting the shot was to go to a bar and party when we had told them specifically, you need a couple of weeks for your immune system to respond. I also think that we need to be very aware of where we are with parents and their vaccine interests. Among children ages 5 to 11, the vaccine uptake is less than 30%. So even less than that are fully vaccinated. So even for kids 5 and up where the data are pristine in terms of both safety and efficacy, uptake has been pretty dreadful. So the idea that a lot of parents under 5 are going to move forward with this plan, I think, was probably a little too optimistic and rosy. I think a lot of parents weren't going to do that. And I worry that the ones who would do that would be falsely reassured by having done that. So I think that being patient and delaying until we have really good data will make for a much better rollout. We'll have safety and efficacy that we can tell parents about. And at that point, we can consider how to reach parents who really aren't so sure. One of the things that's really difficult as a parent and a physician, but also as someone who messages about public health, is how to discuss the data such that they are openly and being transparent and authentic and not overstating the case. I think that the vaccines are so safe and effective in the group 5 and up, kids and adults, that when this trial failed to meet its desired endpoints, there was a sense that if we admitted that, if we acknowledged that and said, well, maybe we should not proceed until we have that third dose data, there was a big sense from my colleagues that acknowledging that was somehow handing anti-vaxxers a gift or giving parents who aren't sure the wrong message and moving the needle away from vaccinating their kids when we have a safe and effective vaccine that's available. I disagree. I think that we should be open and direct about what we know. Moving forward with a safe but not yet fully effective vaccine was just to me and a lot of parents and physicians, a non-starter, both on the medical grounds that we just didn't know what we were giving in terms of protection to the kids. And also we couldn't really look our patients' parents in the eyes and tell them what any of this meant. So I think that there certainly was a lot of pushback from our own camp, the pro-vaccine camp, saying, how could you be pessimistic about these vaccines? And my answer is talking about the data is not being pessimistic. It's not downplaying. It's actually meeting parents where they are. We want to say to them, absolutely vaccinate your kid with a safe and effective vaccine. We'll let you know when we've got that. But to say that we have something that we don't yet know about, I think actually is a pretty big gamble. So we're going to get there. But I think being honest with the public about where we are actually helps parents make the right decision when the time comes.